Welcome to CISM Perspectives. I'm Dr. George Everly. Welcome to our latest installment. I'm going to talk about CISM versus peer support today. Frankly, I'm a little confused by the whole issue, so I thought I would bring it up and try to clarify it. So I've been asked in the last few weeks, what's the difference between CISM and peer support? Should we be doing one versus the other? And that's where I get a little confused. So let's try to review. CISM is a term that describes what people do. It's a type of intervention. It's actually an intervention system, isn't it? Peer support, on the other hand, is a description of who does the intervention. So it's frankly impossible to have a debate, CISM versus peer support, because one is a subset of the other. Perhaps this visual will help. So the notion here is very simple. With proper training, peers can do crisis intervention. They can do critical incident stress management. So when we use the term peers, we typically think of emergency services, disaster responders, first receivers, military, healthcare providers in general, public health. So they would be peers. Those would be people providing psychological support, in this case, CISM services, to people within their own professions. With mental health clinicians, they too can provide CISM services, again, with appropriate training. Also, faith-based leadership, spiritual leadership, the clergy can provide critical incident stress management services. So we would never say, for example, do you do peer support versus CISM? We would never say, do you do mental health versus CISM? So it would be kind of like asking, so do you prefer aspirin or physicians? It's thoroughly confusing. So again, CISM describes what one does. It's an intervention system, while peer support is the description of who does it. So there should never be a debate, peer support versus critical incident stress management. I hope this helps. I'm Dr. George Everly, and I thank you for listening today.